catching breast cancer before it takes hold. Genetic testing can really help identify people at higher risk for hereditary breast cancer.
But here's the thing, fewer black women are getting the chance to take advantage of this technology. Our Dr. Frank McGeorge is here with a closer look at why.
Breast cancer can strike women and also men of all ages and races. Now, while white women are slightly more likely to get breast cancer, black women are 40% more likely to die from the disease, in part due to several racial disparities in diagnosis and treatment. One of those disparities is access to genetic testing. Neonatal intensive care unit nurse Kimyata Frazier feels empowered in her job, helping preemies get healthy.
I take care of them from the time they are born until the time they go home with their families.
But in her personal life, Frazier could do very little as she watched one relative after another battle breast cancer.
My mother just passed away from breast cancer. Her sister is currently dealing with stage 4 triple negative breast cancer. She lost her older sister to breast cancer, and my grandmother, her mother, also had breast cancer.
3 aunts on her father's side also had breast cancer.
It's in multiple generations. There's a lot of affected people.
With genetic testing, technicians take a person's blood or saliva and look for mutations. With testing, patients like Frazier can get preventative measures if they test positive for a known gene mutation.
We may want to screen your breasts more frequently. We may want to do a colonoscopy earlier than you would have needed.
But research finds white women are almost 5 times more likely than black women to be referred for genetic counseling and testing. One study found some doctors believed black patients were more likely to refuse testing, less likely to trust their recommendations, and faced more cost barriers to testing. While some patients do face cost barriers, most insurance now covers genetic testing, and over the past decade, the cost of the testing has dropped to about $250, and sometimes as little as $100. Despite her strong family history, none of Frazier's doctors recommended genetic testing until she asked about it.
It's not painful, it's nothing bad. It can very well save your life or extend your life.
We always wait for the disease to happen and then we treat it. Genetic testing gives you the opportunity to prevent something.
Frazier's test came back negative for the mutations in the BRCA1 and BRCA2 genes, as well as a number of other breast cancer genes on the panel. But because of that strong family history, she's going to receive more frequent screenings, including a mammogram or breast MRI every 6 months. Here's the bottom line. If you have a strong family history of cancer, ask your doctor if genetic counseling and testing would be helpful. And if not, why not? It's also important to take the initiative to find out what your insurance covers. These tests can make a major difference in your screening and detecting any cancer much earlier, or even taking measures to prevent it.